Shannon, and I want to take this opportunity to talk about cigarette smoking and the damage it can do around you. It is 8 p.m. on a humid summer evening, and I'm working diligently to prepare medication for my patients, when I was notified by staff that Mr. Smith in room 711 was having difficulty breathing. His primary diagnosis was emphysema. As I walked in the room, he was leaning across his bedside table, having difficulty breathing, and seemed to be confused. Are you wondering why I'm discussing this patient example with you? This kind of thing happens more often in smokers. I want you to keep Mr. Smith in mind. Cigarette smoking is a bad habit and can be very harmful to your health. And I would like to take this opportunity to talk about two main topics. The first topic is what smoking can do to your health and what smoking can do to the people around you, secondhand smoke. Direct dangers to your health can be respiratory distress, emphysema, and lung cancer, just to name a few. According to Bellamy, Evolution of Emphysema, respiratory distress is when there is not enough oxygen passing through your lungs to the rest of your body. Smoking can cause respiratory distress and can lead to emphysema. Many of you may ask what emphysema is. Smoking can cause emphysema. According to Bellamy, it is the destruction of lung, elastin, and collagen. This enables the exchange of oxygen. The destruction can cause a person discomfort and possibly death. Another condition that can cause death is lung cancer. Cigarette smoking is the #1 cause of lung cancer. According to Ann, cigarette smoke promotes drug resistance and expansion of cancer stem cell-like site population. Cigarette smoking is the largest risk factor of head and neck squamous cell carcinoma. According to Beher, Zion, and Babasubramanian, in human health risks associated with exposure to toxin elements in mainstream and side-stream cigarette smoke. In 2008, 1.8 million people worldwide died from lung cancer. This accounts for 18.2% of cancer deaths. Cigarette smoke is the underlying factor of lung cancer. Now I want to talk about secondhand smoke. Family and friends over the age of 18 have the decision to walk away when someone lights up a cigarette. But our children are forced to breathe in these harmful toxins. According to Wortsman, in child adolescents tobacco use and secondhand smoke exposure, secondhand smoke for children can lead to SIDS, sudden infant death syndrome, childhood asthma, chronic ear infections that can leave a child with hearing deficits. And a study was also proven that people that smoke, parents and guardians, will spend more money on their cigarettes instead of providing nutrition for their children. We need to give our children a fair chance. In general, smoking cigarettes and inhaling these toxins can be dangerous to all and can lead to death. We need to protect our generation against secondhand smoke and encourage the stop of smoking. See, not only was Mr. Smith experiencing respiratory distress, but his oxygen continued to drop. We decided to call 911, and it was later noted that he had a tumor that had metastasized in his lungs that we did not know about. It was too late for Mr. Smith. Stop smoking before you're the next Mr. Smith. Tobacco